25, let's take a look at what's on the agenda. Gene and cell therapy for neurologic disease is moving from proof of concept to real clinical promise. CRISPR-Cas13 RNA editing is correcting MECP2 duplication in preclinical models, while RM201 gene editing is tackling the root cause of Parkinson's disease. Parallel AV and antisense programs, LTS-101 for CLN2 batten, INS-1201, and EXG001-307 for Duchenne and SMA, and allele-specific oligonucleotides for the A53T mutation, are converging on first-in-human studies. New trial designs, such as HERO, MUSCLE, PROPEL, and ASCEND, are streamlining that transition from bench to bedside. Oncology sessions will show how next-generation CAR T cells and viral vectors are finally chipping away at solid tumor resistance. Strategies that co-express GIT-RL, lock PD-1 inside the cell, or introduce new targets like DLL3, MSLN, and EphB4 are prolonging T-cell fitness in hostile microenvironments. Add-on tactics, checkpoint inhibition, oncolytic viruses, or ALK blockade are boosting response rates in glioblastoma, neuroblastoma, and mismatch repair-stable colorectal cancer. Retroviral gene therapy for head and neck cancer and bespoke adenoviral vectors are adding tumor-selective lysis and immune priming to the mix. Infectious disease sessions will highlight gene-encoded antibodies that turn the body into its own bio-manufacturing plant. Phase 1 data show plasmid DNA electroporation can sustain SARS CoV-2 neutralizing titers for more than 70 weeks, while IV delivered broadly neutralizing antibodies silence SHIV in macaques after antiretroviral withdrawal, an early step toward a functional HIV cure. Rare metabolic tracks will show how gene editing and AIV therapy are closing in on functional cures for urea cycle disorders, Fabry disease, PKU, and Gaucher. Both early neonates and long-diagnosed adults are seeing durable enzyme restoration, and new data on neutralizing antibody screening could widen eligibility for AIV trials. Autoimmune sessions will feature Cell, an autologous CD19 CAR T that is delivering drug-free remissions across lupus, systemic sclerosis, and inflammatory myopathies, while allogeneic MSC therapy is healing refractory Crohn's fistulas without safety setbacks. Cardiology and ophthalmology are no longer fringe topics. An IV 9-vector restoring MYBPC, 3 reverses hypertrophic cardiomyopathy in vivo, and a single-dose CRISPR treatment lowers LDL cholesterol by up to 68% in heterozygous FH, subretinal AV, and CRISPR treatments for macular degeneration and X-linked retinitis are improving vision. Even in patients with pre-existing antibodies, and audio consent tools are making iPSC trials accessible to visually impaired participants. Let's now switch gears and see how AI is shaping gene and cell therapy. CRISPR-Gem combines lab screening with machine learning to pick the best activation targets for cartilage repair genes, like PRG4 and BMP2. Algorithms are engineering IVE capsids with 200-fold kidney preference, resolving genome integrity issues with nanoneedle sensors, and designing small molecules libraries hundreds of times more diverse than conventional methods. Microfluidic, AI-guided electroporation boosts hematopoietic stem cell editing to clinical grade with minimal toxicity. Real-time analytics confirm that NT501 retinal implants can secrete protein for years without degradation. At the manufacturing end, machine learning yield predictors and PDL1 stealth capsids are extending therapeutic expression while taming immune responses. Stay ahead in gene and cell therapy research. Like, share, and subscribe for conference updates. Visit lqventures.com or email info@lqventures.com for expert healthcare